In this seminar, I'll provide an introduction to the National Health and Nutrition Examination Survey for dementia researchers. This work was supported by the National Institute on Aging of the National Institutes of Health and by the Institute for Healthcare Policy and Innovation at the University of Michigan. The content is solely the responsibility of me, the presenter, and does not necessarily represent the official views of the National Institutes of Health, the University of Michigan, or the Centers for Disease Control and Prevention. Here is the outline of the seminar. First, I'll briefly introduce the National Health and Nutrition Examination Survey, what most people refer to as NHANES for short. Next, I'll review a few relevant cognitive measures, specifically cognitive assessments obtained from the 2011-12 and 2013-14 surveys, and then we'll conclude with a few analytic considerations. So the overall objective of NHANES is to assess the health and nutritional status of adults and children in the United States. It's a large survey that's capable of making population-based estimates for health status and specific health conditions, certain types of healthcare use, including prescription medication use, dietary supplements, and other types of healthcare use, nutritional status, dietary and health behaviors, as well as environmental exposures. Now, NHANES is not new. Its origins can be traced back to the National Health Examination Survey back in the 1960s that grew to evolve in the 1970s certain elements of nutrition and diet. NHANES 1, 2, and 3 were actual cohort studies. And what I mean by this is the individuals who were participating in NHANES were followed over time. Hence, they were designed to look at temporal relationships between independent and dependent measures. More recently, NHANES has been conducted on an ongoing or continual basis. Since 1999, it's basically been a series of cross-sectional data sets that get released in 2-year increments. Now, there are a ton of different measures in NHANES. One thing to keep in mind is that the same health measures aren't necessarily found in every single NHANES survey. Now, of course, some of the basic factors around sociodemographics, basic physical characteristics, and things like blood pressure are always measured in NHANES. But a lot of the more interesting and ornate measures are not necessarily obtained in every single NHANES survey because they're expensive. Take, for instance, grip strength tests. Those are only obtained in the 2011-12, 2013-14. Now, it turns out that cognitive assessment just happens to be an intermittent measure. So in other words, not every NHANES survey includes data on cognitive assessment, and there are only a few cycles that actually do in recent history. So what does NHANES recruitment and data collection look like? So it starts off with a recruitment letter. From that, study eligibility is determined by NHANES staff, and people who are eligible and agree to participate then undergo an in-home interview. During this in-home interview, they obtain data on demographics and social characteristics, health status and health conditions, some basic things around healthcare use and health insurance. Then, people are invited to participate in an actual examination. Mobile exam units travel around the country and function as on-site units to collect measures regarding height and weight, blood pressure, more detailed information on dietary measures, as well as specific laboratory measures like urinalysis and blood work. So we still refer to NHANES as a survey, but you can see by this it's much more special than a typical survey because they actually are collecting objective health measures. So what does the NHANES sample look like? For continuous NHANES, it is a sample of the U.S. civilian non-institutionalized population. Non-institutionalized refers to people who are not actively serving in the military or otherwise institutionalized at a medical or mental health institution or incarcerated. It contains about 5,000 individuals that are examined each year. And like I said before, 2 years are pooled together and released as a single survey, so the sample size is approximately 10,000 individuals. Now, one thing that's kind of special about NHANES and other similar surveys is that they oversample specific populations. They specifically oversample Hispanics, non-Hispanic Blacks, non-Hispanic Asian Americans, older individuals, and low-income whites. Okay, let's talk a little bit about a couple of the cognitive measures that might be of interest to you that can be found in NHANES. So there are a lot of articles that have come out, still even today, using NHANES data, cognitive measures from NHANES to look at associations. These that are coming out using continuous NHANES are typically cross-sectional surveys, like I mentioned before. So here's one that looked at coffee and caffeine intake, association with the cognitive performance in older adults. Another one looked at hearing loss with cognition, and associating a few dietary measures as well with cognitive performance. So the cognitive measures, not everyone in NHANES was eligible to undergo the cognitive assessment. There was some eligibility criteria specifically for individuals who underwent the cognitive measurements. The restrictions that were made were these had to be individuals that were 60 or older. They had to be speakers of English, Spanish, or an Asian language. And they had to be able to complete the cognitive assessment independently. This is important when you think about something like dementia, for instance. Basically, it required that respondents were able to complete it on their own, which eliminated individuals who were potentially using a proxy. I looked at the frequencies in the actual 13-14 NHANES survey, and you can see that only 19 were actually removed because they were requiring the use of a proxy. So this could potentially be a big concern when you think about something like Alzheimer's disease, because you would be potentially excluding individuals with more severe disease. But I was happy to find that it wasn't that many individuals. So out of the roughly 1,800 individuals, only 19 of them were excluded because they were ineligible due to the use of a proxy. Okay, so what are the cognitive measures that were obtained from the 2011-12 and 2013-14 NHANES surveys? They had 3 primary cognitive performance measures that included word learning and recall, animal fluency test, and digit symbol substitution test. The word learning and recall was based on the consortium to establish a registry for Alzheimer's disease. There were 3 learning trials. These were basically, the individuals were provided with a list of 10 words, and they had to repeat those words immediately. They were given a point for how many words they correctly repeated. So scores were potential from 0 to 10. Then at the conclusion of the cognitive measure assessments, about 8 to 10 minutes after, they gave one final delayed learning trial, which they were asked to go back and remember those original 10 words. The animal fluency test was a test where the respondent was asked to name as many animals as possible in 1 minute. The digit symbol substitution test, individuals were presented with 9 number symbol associations or pairs, and then using pen to paper, they were provided with numbers and asked to sort of sketch the symbols associated with the numbers, up to 2 minutes. So typically, people do this sometimes in different ways, but typically the 3 learning trials, immediate recall, and the 1 delayed learning trial is aggregated to a total score in terms of word learning and recall that obviously ranges from 0 to potential high value of 40. Animal fluency, well, it's basically based on how many animals you can possibly name. I don't know if there's necessarily infinity animals, but there are potentially a lot of animals, and that could be named. Digit symbol, actually, they're provided with up to 133 numbers to associate with the symbols. The scores range from 0 to 133. So just to look at what the distributions of these different measures look like, I pulled the 2013-14 NHANES survey and looked at some histograms. So here we can see the histogram of word learning and recall ranging from, again, potential score of 0 to 40. Animal fluency test. This has potential for as high as it can go, but I think the highest performer it looks like was just under 40 animals in a minute, which is quite impressive. I don't think I could do that well. And the digit substitution test has a range of potential values of 0 up to 133 associations, and these are what the distributions look like. Now, people do different things with these different measures. You can look at them individually, and some people will try to combine them into a global score of cognitive assessment. Sometimes there's something that's very common in the literature to look at the bottom 25% of individuals in terms of performance on a test, identify them as low cognitive performance versus, adequate or high performance, the remaining 75%. That's one approach to basically collapse these individually into a dichotomous measure of low versus adequate performance. Also, there's some individuals that will turn these into z-scores, and which will then better allow them to be combined into a global score, because z-scores, as you remember from elementary statistics, takes away the original units and scale and allows sort of puts it on the similar scale so that you can actually include them to create an overall performance score. So a lot of options in terms of how you can combine these and work with them individually or in aggregate, and perhaps in a future seminar I'll do some demonstrations with some actual data. All right, let's take a quick look at the NHANES website so I can show you where you can actually obtain these data yourself. So it's an incredibly user-friendly website. When you first click on the website or type it into your browser, this is what it looks like. A lot of information on the survey, the history of the survey, etc. But you'll be most interested over here to click on this questionnaires, datasets, and related documentation, which will then open up a new page. Here we can see the different NHANES surveys, again, like I said before, in 2-year increments, ranging from the first continuous NHANES survey in 1999 to 2000 up to the most recent. Now, you can click on the most recent one, but the data haven't been released yet, so many of the different factors will be blank or missing. The ones, if you're interested in dementia research, that you'll be most interested in is, like I said, the 2013-14 and 2011-12 NHANES surveys, because those are the ones that actually included the cognitive assessments. And they are similar enough that you can append the data to increase your sample size, which is really important. So I thought we would just take a quick field trip and let me show you around the NHANES website in real time. Like I said, there's a ton of information about the data collection efforts and what have you, but over here you'll want to click on the questionnaires, datasets, and related documentation tab. Here we see the individual different NHANES surveys, as well as some of the more historic versions, and we'll focus on NHANES 2013-14, which is the most recent data with the recent survey that included cognitive measures. Keep in mind, too, that this most recent one, you won't necessarily see very many measures because they're in the process of actually putting those together and aggregating them. So this is where a lot of the action can take place, and you can find an enormous amount of information about this particular NHANES survey. Down here, you see a whole bunch of information on the actual questionnaires and the instruments used and the methodologies used for the various components. And down here, you can see the broad different categories of different types of data. Demographics data. This is basically where you get the information on the sociodemographic characteristics of the survey participants. All NHANES data are organized in a very similar user-friendly way. For each data file, you can see the data documentation and the actual data set itself. The documentation, you can see here, walks through every single variable. At the beginning, it provides you with some information and a description of the data collection, any specific restrictions or eligibility criteria to be aware of, and then it walks through every single variable in the data set and lets you know what the frequency is and the range of plausible values. Now, this contains sociodemographic data, dietary data if you're interested in that, examination data, which includes body measurements, blood pressure, some other types of exams, laboratory data, and questionnaire data. So there are a ton of different health questionnaires in NHANES, as you can see. Each one, they provide you with the documentation and the actual data set. All the data sets are in SAS transport files, which are pretty user-friendly. Most different types of software can handle them easily. And down here, we can see the cognitive functioning measures. Here's a description of some of those measures I just mentioned to you, the different trials. Also some other information in terms of people who were eligible or perhaps didn't necessarily finish the cognitive assessments. And then over here is where you'd go and download the data set. Let's end with a few analytic considerations. First, this was just a crash course and very general introduction to NHANES. If you're interested in using this dataset, make sure to check out the tutorials located on the NHANES website. They provide a step-by-step guide to analyzing NHANES data, and they're also available in lots of different software packages. Next, I demonstrated how each different measure is found in a different file on the NHANES website. This means you can't necessarily download one single NHANES file that contains all NHANES data. You must merge one-to-one the different files using the respondent's ID. The variable in NHANES to do so is called SEQN. The only exception to this is dietary data. That would be the only example where you'd have a one-to-many merge because you have many different sources of diet for each individual. This is fairly unusual. Most people will just be conducting one-to-one merges. If you're using NHANES data, I recommend you start off with the demographics file and then merge on other data files. Next, we talked about the two primary data collection efforts in NHANES, the in-home interview and the exam. We also talked about the different weights that are used to upweight and extrapolate our findings to the US population. It just turns out that the sample isn't identical in terms of the number of people who participate in the in-home interview versus those that participate in the exam. Not everybody who does the interview participates in the exam. Thus, there is a different weight that's used to analyze the interview data versus the exam data. They're very, very correlated. They're very similar, but they're slightly different. So depending on what data you're working with, you need to use a different weight. So if you're using just household interview data, if all the data you're using comes from that source, use the interview weight. If you're using exam or lab data, use the exam weight. If you've put them together by merging them, if you include any exam or lab data whatsoever, use the exam weight, even if the measure is just a simple covariate. The last thing to be aware of is, NHANES makes the data publicly available by de-identifying it. You can't find necessarily the geography and those types of things in the publicly available data. However, they do have more sensitive data stored securely at the research data center that you can request to get access to. This would provide the opportunity to link to administrative data, identify different individuals' locations and census data, as well as some more sensitive data from younger individuals and information on drug and alcohol use, sexual activity, and mental health. So consider working with us here at the Center to Accelerate Population Research in Alzheimer's Disease if you are an established or emerging scholar in Alzheimer's or dementia research in general. More information can be found on our website, capra.med.umich.edu. Please consider joining our CAPRA email list where information can be found on this on our website. If you subscribe to our email list, you'll get regular updates when we release these seminars in the future. And lastly, make sure to check out our podcast, Minding Memory, where we'll talk with leading researchers in the field and tackle some interesting topics. Thanks for listening.